guys! Today I want to talk about Canadian healthcare system, and as you probably know already, this is one of the best systems in the world, and it's not just my personal opinion. You can check information online, you can Google it, and you can find a lot of interesting facts on Google. But I want to briefly touch some moments and show you how it works here in Canada and how much you have to pay if you have to pay. So first of all, you should know that we don't have a one federal medical plan. We have 13 different provincial plans. Under this system, all Canadian residents have access to medical, hospitals and other services without paying out of their pockets. Okay, so let's see who is eligible to get this coverage. First of all, we'll talk about OHIP. OHIP is an Ontario Health Insurance Plan and valid only in Ontario. So, you have to know that tourists and visitors, they are not eligible. They have to obtain their own insurance. You may be eligible for the OHIP if you are a Canadian citizen, permanent resident, landed immigrant, if you have a work permit, valid work permit in Canada, or if you're a refugee or other, they call them protected person. We'll post the whole list of eligibility so you can check if you are there, and I have to say that according to the rules, generally speaking, you have to be, first of all, Ontario should be your primary residency, so you can't live, let's say, in Florida and in Ontario, like months there, months here, so you should be more in Ontario, and you should be here at least 153 days of the first 183 days. So you can just come and leave and request OHIP. You have to be literally here. And I remember when we just came here as a landed immigrants, we applied for the OHIP right away, but we had to wait 3 months while we get it. So it's a good advice to get your private insurance that can cover your needs, your emergency situations for the first 3 months. For this period of time, for family of 4, let's say, price could be up to $1,000. So you have to check the prices and choose for yourself. But this is a good option because even something happen, you have to go to walk-in clinic or to see the doctor, and you have to pay out of your pocket. And it's pretty expensive because one visit could cost you approximately $200, and it's much cheaper to pay for your insurance and wait for your OHIP. And OHIP is covering everything except dental services, eye doctor, and some cosmetic surgeries and cosmetic treatments. And also they don't cover chiropractor, massages, and different services like that. So how it works? First of all, you have to find a family doctor, and family doctor is very important here because sometimes they only one person who can send you to the particular doctor who can help you with some issues. It's good to have family doctor because they know all your history, they know what's going on with you, they have everything in your file, it's all in the system, they don't have to ask you all these questions all the time. Another option is walk-in clinic. Walk-in clinic is the organization where you can go and just wait in the line. If you have like some questions, you have to meet doctor and you don't want to book appointment, let's say for next week or next month or any other day. So you can just come there and sit and wait like few hours or maybe 20 minutes. So it depends on walk-in clinic, and you can see doctor and who has no access to your history, but you can explain what bothering you and he can help you. He can give you prescription, or he can just give you some advice, or he can just tell you what to do next. And the next option, and the more popular option here, I would say, it's emergency room in hospitals. So if something happened, and let's say if you can drive by yourself or someone can drive you, you can go to emergency room, and again you can wait in the you can line up and wait, and you can see doctor, and doctor can help you, and they can help you with any situations, whether you have a heart attack, but in this case it's better to call emergency, and they can come and pick you up, and they can do everything they have to do with no lines, of course, because it's very major problem. And if it's something simple, you have to wait, unfortunately, and sometimes I know that you have to wait, let's say from 20 minutes to few hours, like couple of hours, maybe like even up to 4 hours in emergency room, but you have to be treated for sure. And you can put stitches. We recently had this situation with our daughter. We went to emergency room, she fell down in daycare, and we went to emergency room, and they put some stitches on her, and they did everything in less than 2 hours. So technically it's a good option, but you have to live close by to the hospital, or you have to drive to the hospital. So three major, let's summarize. First of all, you need to find a family doctor. It's easier for you, because let's say if you want to see a doctor who can help you with some particular stuff, let's say, I don't know, with your, let's say with your allergy, only family doctor can send you there. You can just come in and say, oh, you know, can you check my allergy? So your doctor should send you there. Second option is walk-in clinic, where you can come and just talk to the doctor and explain what's bothering you and get treatment. And emergency room, when you can get treated, and with some major situation or even minor ones as well. So if you have OHIP, you can use all these options, and you can go and just see the doctor. If you don't, you have to obtain insurance. Also, you can get some benefits from the company if you work for some companies who can provide you some extra benefits. It's a private insurance that can cover you extra expenses for the, let's say, dental assistance or eye doctor, or they can cover everything that OHIP is not covering. You can get from your company, or you can get your personal private insurance and get these benefits, but you have to be with this plan for a few years, I believe, to start use them, if it's a good plan. And sometimes it's a good option, because dental services, let's say, very expensive here, so sometimes it's easier to buy some private insurance and to use it in a few years. It will be cheaper to pay this insurance cost than pay for the dental assistance in general. And you have to remember that it's completely free here. You don't have to pay for any doctors except this that we mentioned: dental, eye doctor, cosmetic surgeries, and chiropractor. If you have any questions, please let us know. Bye!